Kira or Kyra. Apologies, I'm not sure how to spell it, how to pronounce it, Kira or Kyra, because I've interacted with you quite a bit, but only in written form. So I apologise if I've butchered the pronunciation of your name. Hi, Raf. I have a question for you. I hope you find it slightly interesting. Apologies for the long explanation. When I jog or do too much physical exercise in general, my right knee gets uncomfortable or flares up. Both knees naturally roll inwards or medially, my right worse than the left. Do you know if knee rotational position contributes to this issue? Particularly when I run, I try my best to stop them rolling medially, as this was the advice I was given when I was younger from a physio. But I'm starting to think this could actually be the problem. Should I just let them be? After all, this is how my body was built. I was literally born this way. Your recent talk on posture got me thinking about it. Thanks for your awesome and critical thinking, Kyra or Kira. My apologies for getting that wrong one way or the other. You don't say where the pain is in your knee, but basically regardless, the prescription of exercise is going to be pretty much the same. So there is a place for changing your movement strategies sometimes. So if you have pain that hurts when you do it one way and doesn't hurt when you do it the other way, so if, like, for instance, when you run, you have pain, and if you turn your knees out, the pain magically disappears. Well, I'd say there's an argument for turning your knees out. But if you've been trying to do that for years and it still hasn't taken and you still have pain, it sounds like it's not really probably doing that much. And it's really, I would really use a biomechanical change like that, turn your knees out, as really just a kind of a temporary get out of jail free card whilst you strengthen up the area. So people run with all kinds of weird and wacky alignments, gaits and positions at all kinds of levels, like including elite runners. So it's very unlikely to be the case that your alignment is, quote, causing the pain, although it could well be that you've become sensitized to a particular position, and so thus changing to a different position that you're not sensitized to might alleviate the symptoms. But that's not to say that the new position that you're not sensitized to is the, quote, correct position and the old one was the, quote, incorrect position. It's just that, like, you've become sensitized to that position. Like Steve Martin in Dead Men Don't Wear Plaid, the classic 80s detective spoof, where he's got a thing where if anyone says the word cleaning lady, he goes into this psychotic fit and starts murdering people. And so he's sensitized to the words cleaning lady. And so if you just don't say cleaning lady, well, the issue doesn't happen. And so that's kind of, what might happen with, but there's nothing actually wrong with cleaning ladies. Cleaning ladies are fine. That's not their fault. They didn't do anything. And probably, could be the same with your knee, that it's, turning medially is not a problem. It's just that maybe you've become sensitized and the sensitization has been associated in your central nervous system with that position, and thus choosing a different position might help. But it doesn't sound like it's helping to me, because you've still got the issue, right? Even though you're, diligently turning your knees out. So the general prescription for knee pain, which in high-class lingo is called patellofemoral pain syndrome, and there's a hint there when we call anything is called a syndrome and simply describes the symptoms. So patellofemoral pain, patella is the kneecap, femur is the thigh, so the patellofemoral is like somewhere in your kneecap and your thigh. Pain syndrome just describes you've got pain in your knee somewhere. So any kind of diagnosis that simply describes the symptoms gives you a big heads up that we have no clue what's causing it. But the exercise is quite effective for patellofemoral pain, and the best combination of exercise is hip strengthening. And I'm not just talking about glutes. I'm talking about every muscle in the hip. So hip extensors, glutes and hamstrings, hip flexors, your hip flexors, hip abductors, hip adductors, so just everything in the hip, plus knee strengthening, so quadriceps, hamstrings and calves, because the calf muscle also crosses the knee. So in other words, strengthen the whole leg. But for some reason unknown to science, if you start with hip strengthening, so start by focusing on hip strengthening, and then a few weeks in, 3-4 weeks in, add in some add in the rest of the leg, knee and calf and all of that. That will probably give you better results. So I would start with things like glute bridges and side leg lifts and leg raises and knee squeezes and side crab walks and things like that with a band around your knees to strengthen up the hip, the inside, the outside, the front and the back of the hip. Once you've been doing that for a bit, then keep doing it and add in whole leg work, lunges, squats, footwork, sideline footwork, legs in straps, all of this stuff just to strengthen everything in the leg. And then I would just advocate a graded exposure approach. So basically run as far as you can run with tolerable pain. If you get a bit of pain when you run, I wouldn't worry about it. If the pain settles within 24 hours after you finish your run, it's fine. If it doesn't settle within 24 hours, then do run less distance next time until you find a distance and a pace that will enable you to run and for your symptoms to settle within 24 hours after you run. And then do that for a few weeks and then see if you can push the envelope a bit, see if you can run a little bit further and see if the symptoms will settle within 24 hours still, and just keep doing that. Just basically keep gradually pushing it, keep doing your strengthening of your hip and all of the leg muscles. So hope that helps.